Ladies and gentlemen, welcome once again to another episode of the Think Clinical podcast. My name is Hamza. It's always great to be here, and especially when we have the opportunity to share such beautiful, insightful conversations and opinions. We really do appreciate all the feedback we get from each and every one of you. Thank you so much. So welcome once again to another very exciting episode. Today we'll be talking about something really exciting, and this has been a very important topic for me ever since I finished medical school and have had the opportunity to work in the government sector. And there's been a lot of questions that I needed to ask myself at different levels, but again, just understanding how our government healthcare system is set up in Africa, and especially Ghana, where I come from. The biggest question I always ask myself is it possible for us to explore the principles of entrepreneurship, even in a setting where we have a government setting that is often has challenges in terms of what efficiency looks like, in terms of what productivity looks like, in terms of what needs to be done when to be able to achieve the best results at every point. Is it possible to apply the principles of entrepreneurship to make these government facilities more sustainable, to make them more efficient in the long term, to actually make them stand on their own and stop depending on all the different sources of funding that they need to be able to keep going, to be able to manage their debt more effectively? How can we explore all the inefficiencies in these institutions and make them more efficient? This has been a question I've asked myself for so many years, and I must say it's really an interesting one, because anytime I feel like I figured this out, it always comes with more questions on how to move beyond some challenge that comes up at some point of this whole conversation. But this is going to be a two-part series, so this is the first part of it. And for the first part of this conversation, we will be focusing on our government hospitals in Africa. We'll be looking at how these have operated over the years, where they came from, what challenges they've been having over the years, how we could possibly look beyond these challenges, and recent innovations that most of these hospitals are using to get beyond some of the challenges they have. How can we explore more sustainable measures, more sustainable financial and operational measures? How can we explore the principles of entrepreneurship to be able to further benefit what we hope to achieve in our public sector? So this is going to be a very exciting episode, and so the first part of this conversation is going to focus on just the background and all the things that we need to be aware, know about our government healthcare system, and then subsequently we'll talk about some principles that we can employ or you can use in this setting. So welcome once again. If you haven't done so already, please remember to subscribe, like, and share the page. We'll always appreciate all the feedback you give us. If you have any comments, if you have any inputs to some of the conversations we have, please leave it in the comment section. We will definitely respond to you at some point, but we would like you to be as engaged as possible in some of these conversations, because in the long term, these are going to be translated into how sustainable we can make our healthcare infrastructure overall. So welcome. Now in Africa, we have all these countries who are set up differently and who have different healthcare setups. But the majority of the people in Africa depend on these government institutions for their healthcare needs. We've had in the recent years a drastic increase in the number of private hospitals that we have in Africa. and these are just slowly increasing in the amount of services that they can provide to people. So I remember when I finished medical school, most of the private hospitals we had around were mainly focused on just providing very minimal primary care, just mostly outpatient services, some minor surgical procedures. And in a span of about 12 to 14 years, I've seen a rise in the complexity of cases that are managed in private hospitals, as well as the spectrum of services. So yes, gradually private businesses and private hospitals are helping to bridge that healthcare accessibility gap. But the bigger conversation is that most of the healthcare needs of the people on the continent still depends on what these government hospitals provide. Unfortunately, the quality of service that has been provided over the years has been compromised in so many ways, so it has made it difficult. And a lot of these challenges are mainly due to the problems that these government hospitals have faced over the years. So let's go back a bit into history. So during the colonial era, these hospitals were set up mostly to provide services for any of the colonial institutions that were in the continent. So this was supposed to make sure that they have access to the right kind of healthcare service, make sure that their families had access to the right kind of healthcare service. But as the years progressed and post-independence, these hospitals were handed over to the governments, and these governments now had to continue sustaining and managing these hospitals and making sure that they are continuously opened and they have the infrastructure available to be able to provide services for the different people. Now, just so that we understand how these are set up. Now, most of the countries in Africa, so out of the 54 countries, a lot of these healthcare institutions operate under the ministry of health of some sort. And this often, they provide the public health policy and regulations around how these hospitals should be operating. Now, there are different levels of care that usually are provided at these hospitals, and it ranges from primary healthcare services all the way to tertiary. And even now, we have African countries that have hospitals that offer quaternary services. So it's expanded and it's getting bigger. But funding mostly for these hospitals come from a national and local government budgets. So a lot of them have to keep their doors open through these budgets. And because of the reimbursement models that are available in these hospitals, sometimes hospitals offer services and for years they don't get any payment from health insurance companies, especially when you have a national health insurance infrastructure in place that does not have the funding to keep these hospitals reimbursed, to keep them very operational. So, but by virtue of the fact that these are government hospitals, they need to keep their doors open and offer services anyway to any group of people who come in. So one of the big things that we'll be talking about is in terms of funding. How would these hospitals be able to look beyond the funding that comes externally, the budgets within which they need to work, and be able to find alternative ways of generating income internally so that they can keep their doors open and also keep the quality of services that they provide up. So a lot of these things have to be assessed based on the challenges that these hospitals face, and we will walk through some of these challenges. But one of the big things that we need to understand is that these hospitals are not just made up of walls, and they're not just made up of machines. These hospitals need people to be able to run them. And the very mindset and the qualifications and what these individual people need is important as far as the long-term financial and operational sustainability of these institutions are concerned. But let's look at some challenges that these government hospitals face. And just like I mentioned earlier, one of the first things that we have to acknowledge, which is one of the biggest problems that we have, is funding. So there's always underfunding and even just resource allocation in general, because a lot of these hospitals get their funding from the government and the local and national governments, but if enough funds are not allocated to keep these hospitals operational, then it's going to be a challenge. So one of the things that need to be looked at in terms of a challenge is how much funding are we actually allocating to these hospitals to keep their doors open and to be able to offer the kind of services to the people. The second one, as I said, is that hospitals are not just made up of walls and machines. Hospitals are operated by people. And for a long time, we have experienced shortages in the number of experienced people in the country who would be able to offer this service to the people who actually need it. And these shortages come in different forms. One is how many qualified healthcare professionals are we churning out every year to be able to be in a position to offer the right kind of and the right quality of service to our people. The second level of shortages come from the fact that now, when even we have the few people trained who would be able to support the country, we have these people experiencing different levels of job satisfaction, and for those that are in the lower aspect of that spectrum, they tend to find that satisfaction elsewhere, which could be within or out of the continent. Now, when this happens out of the continent, then you are going to have a situation where there's a big shortage in the number of healthcare professionals that are in. The big question is what measures, what infrastructure can be put in place to make these working places appealing and rewarding enough for trained healthcare professionals who dedicate a lot of their time and energy and effort into taking care of patients to be properly taken care of, such that they do not need to explore other options of job satisfaction, especially outside the continent. And I do remember that when I practiced in the government space so many years ago, there were conversations about why healthcare professionals, even within teaching hospitals, they don't have any form of health insurance or health benefits within the institution. So if as a doctor I had to undergo a procedure, or if I was sick, I have to pay my medical bills or show proof of some form of health insurance plan that is capable of covering my hospital bills. Now, anybody who operates within such an environment would have a very huge sense of insecurity, because if the very institution that you work with, which is a hospital, does not have the infrastructure and the measures in place to support you when you have medical needs, then it becomes a problem. So many times, as a doctor, you have to pay for your own medical bills without any form of health plan or support within the hospital infrastructure to support you. Now, in this case, people would continuously explore other options of making sure that they're able to secure themselves and able to secure their families. The third thing is that there were so many occasions that we walk into the hospital and you do not have supplies or medication that you need to work with. Now, with these lapses in supply chain management, healthcare providers or clinicians walk into the hospital and continuously get frustrated because the very makeup of the job is such that you are already under a lot of pressure to deliver quality care. Now, if you do not have what you need to deliver this kind of care, then that becomes a problem. So if the third challenge that most of these government hospitals face is just an inefficient way of managing supply chain, where medications, drugs, supplies, whether consumables, whatever the doctor or the hospital needs to operate is not available for them to use, in which case there is continuously a build-up of frustration. there's a continuous decline in the quality of services that is provided, and this just escalates into bigger problems beyond the profitability or the financial health of that government institution. The fourth challenge that a lot of these government hospitals face is due to the fact that the healthcare system is so fragmented that there is no continuity of care or an infrastructure in place that ensures continuity of care within the different tiers of services that are provided. So if you are moving from a primary healthcare institution to a secondary or to a tertiary, there is no continuity of care and beyond what has been written on a referral note or a conversation that has been had with the previous doctor, in which case there's no connection between these, and that leaves each unit on its own to operate on how or what needs to be done for the patient. There's a fourth problem, which is just the fact that a lot of these hospitals have an over-reliance on external funding. Now, this is where my thought process has been for so many years on how we can explore avenues of improving efficiency within the company, applying principles of entrepreneurship to make sure that we are able to keep these government institutions well positioned and well funded to continuously provide care and not be too reliant on external funding. Now, just to put this into context, a lot of these hospitals have almost 60% of their funding coming from the central government, and just about 40% of expenses are funded from internally generated funds. Now, that is in the long term unsustainable, because if the government is not in a position to continuously provide funding and support, these hospitals continuously deteriorate over the years until some external entity is able to identify a need within the hospital and revamp some section of the services. So we continuously have hospitals, government hospitals for that matter, with no plan internally to be able to generate funds that will keep them functional and running for a long time. And that is a very big problem when a big part of what you do is depend on funding from external sources. Now, this is a bigger conversation for the second episode of this, where we will be focusing on how we can strategize in ways that we can be able to generate these funds internally. Now, there's also the conversation around infrastructure, and just the fact that, with the exception of those government institutions that are found in the urban areas, there is a general lack of the proper infrastructure that is needed to deliver that kind of quality care that most of these hospitals need. So if you go to the urban areas, you would find hospitals that are so well equipped and so well positioned to offer the right kind of services and the right spectrum of services, but the same government institutions in other areas of the countries would be so disadvantaged in providing this kind of care. So this is another challenge that needs to be appreciated from all aspects. But we need to look at this problem holistically and not just in the context of the fact that the deteriorating factors within the institutions are only affecting the institution financially. We need to look at it holistically and look at how it translates into patient care, how it translates into the quality of care that we give patients. The unfortunate thing is that the more we try to look deeper into some of these issues, the bigger some of these are. When we just actually realize that we are just looking at the tip of some of these problems, and they are more deep-rooted than we actually see them right now. So a lot of this is going to be conversations around just basic operational strategies that we need to start thinking about as African countries and operating within government healthcare institutions, and how we can optimize processes within the institutions and actually make them more self-sustainable and reduce the strain that these have on the government. So in the next episode, we'll be talking about and walking through some of these strategies that will be helpful, and just exploring ways that we can be more effective as a people to be able to continuously support whatever external funding is coming in with the efficiency of operations or whatever we need to do internally to keep the quality of service up at all times within these institutions. So please stay tuned for the next episode next week, where we'll go into this, but think through these challenges that I just outlined now, reflect on them, and I think the conversation next week will become more insightful, because then we have the foundation to be able to have a broader conversation. So thank you very much for joining me today. This has been another episode. Please remember to subscribe, like, and share, and I will see you next week.